Welcome back. Today we're going to talk about Unit 6, Meeting the Resident's Need for Mobility. We're going to talk about the CNA's role in residents' care related to mobility. We need to encourage residents to participate with control and confidence in their mobility. This is extremely important. It promotes independence and also gives the residents self-worth when they are able to do things for themselves. We also need to prevent deterioration in a resident's condition, which is also called functional decline. Let's talk about functional decline. A decline is a deterioration in a condition. It is not permitted according to OBRA 87 unless it is medically unavoidable. We talked about OBRA 87 in Unit 1 and 2. Saying that a decline was caused by normal aging or a chronic illness may not always be acceptable. Licensed facility staff assess the resident on admission and make a record of this assessment. The facility must maintain or improve the resident's condition compared with how he or she was at the time of admission. For example, if the resident could walk at the time of admission, the facility must maintain this ability. If the resident cannot walk, the facility must do everything possible to restore their mobility. If walking is not possible, mobility is provided by an assistant device or in a wheelchair. If the skin was clear on admission, the facility must prevent pressure sores and injuries. If pressure sores were present on admission, the facility must take steps to heal them. These are simple examples that apply to the musculoskeleton and the integrity system. Declines can occur in all areas of a resident's life. Let's talk a little bit more about reasons for decline. Decline in function occurs for many reasons. Conditions such as stroke, falls, fractures, or even illness such as pneumonia can cause weakness and loss of function. Other conditions that increase the risk of decline are cognitive impaired, the inability to ambulate, an unresponsive condition, poor skin integrity, poor nutritional intake, inadequate fluid intake, chronic pain, deformities, edema, general weakness, medications, and certain medical conditions and terminal diagnosis. We need to always provide safety for our residents when they ambulate. Always make sure that they have a clear pathway. Following the resident's care plan, including restored activities, is also very important. We will learn more about these in units to come. Now let's talk about good body mechanics and how it's beneficial to the CNA. Body mechanics describes how to use the body correctly when moving residents and/or objects. Using good body mechanics makes the best use of the strength, avoiding fatigue and injuries such as back strains. When the CNA uses good body mechanics, along with proper lifting and moving devices, the chance of injury to the resident and self decrease. Back strains or injuries is one of the greatest risks that nursing assistants face. Using proper body mechanics is an important step in preventing back strains and injuries. Body mechanics is the way the parts of the body work together when you move, and understanding some basic principles of body mechanics will help you keep you and your resident safe. All staff members, including you, are responsible for safety in a facility. It is very important to try to prevent accidents before they occur. Prevention is the key to safety. As you work, watch for safety hazards. Always report unsafe conditions to your supervisor promptly. Now let's talk about good body mechanics. You should always use the larger, stronger muscles to do the job. When moving or picking up a heavy object, use the large muscles of the legs instead of the weak back muscles. Always squat down at the knees. Keep one's back straight. Raise up using the leg muscles. Never bend at the waist or twist while lifting a heavy object. Use both hands and arms rather than one to pick up a heavy object. When standing, sitting, or lying down, try to have your body in alignment to have good posture. This means that the two sides of your body are a mirror image of each other, with body parts lined up naturally. Posture is the way a person holds and positions his body. Maintaining correct body alignment when lifting or carrying an object by keeping it close to your body. Point your feet and the body in the position you are moving. Avoid twisting at the waist. You also need to have a base of support. The base of support is the foundation that supports an object. The feet are the body's base of support. The wider your support, the more stable you are. Standing with your legs shoulder width apart allows for a greater base of support. You will be more stable than someone standing with their feet together. Center of gravity. The center of gravity in your body is the point where the most weight is concentrated. This point will depend on the position of your body. When you stand, your weight is the center in your pelvis. A low center of gravity gives a more stable base of support. Bending your knees when lifting an object lowers your pelvis and therefore lowers your center of gravity. This gives you more stability. It makes you less likely to fall or strain the working muscles. Some of the examples used for good body mechanics include: when lifting a heavy object from the floor, spread your feet shoulder width apart. Bend your knees. Use the strong, large muscles in your thighs, upper arms, and shoulders. Lift the object. Pull it close to your body, level with your pelvis. By doing this, you keep the object close to your center of gravity and your base of support. When you stand up, push with your strong hips and your thigh muscles. Raise your body and the object together. Do not twist when you are moving an object. Always face the object or person you are moving. Pivot your feet instead of twisting at the waist. To help a resident sit up, stand up, or walk, protect yourself by assuming a good stand. Place your feet 12 inches or shoulder width apart. Put one foot in front of the other with your knees bent. Your upper body should stay upright and straight in alignment. Do this whenever you have to support a resident's weight. If the resident starts to fall, you will be in a good position to support him or her. Never try to catch a falling resident. If the resident falls, assist her to the floor. If you try to reverse a fall in progress, you could injure yourself and/or the resident. Bend your knees to lower yourself rather than bending from the waist. When a task requires bending, use a good stand. This lets you use the big muscles in your legs and hips rather than the small muscles in your back. If you are making a bed, adjust the height to a safe working level, usually waist high. Avoid bending at the waist. Keep the following tips in mind to avoid strain and injury. First, assess the situation. Clear the path and remove any obstacles. Get help when possible for lifting or helping residents. Use both arms and hands to lift, push, or carry an object. Hold objects close to you when you are lifting or carrying them. Push objects and equipment rather than lifting them. Avoid bending and reaching as much as possible. Move or position furniture so that you do not have to bend or reach. Avoid twisting at the waist. Instead, turn your whole body. Your feet should point towards what you are lifting. When moving a resident, let him know that you will do what you will do so he can help if possible. Count to 3. Lift or move on 3 so everyone moves together. Report to the nurse any task that you feel you cannot do safely. Never try to lift an object or a resident that you feel you cannot handle. Most accidents that occur in a facility are falls. Falls can be caused by an unsafe environment, loss of abilities, disease, and medication. Problems result from falling, ranging from minor bruises to fractures and life-threatening injuries. A fracture is a broken bone. Falls are particularly common among the elderly. Older people are often more seriously injured by falls, as their bones are more fragile. Be especially alert to the risk of falls. The factors that rise from the risk of falls are clutter, throw rugs, exposed electrical cords, slippery or wet floors, uneven floors or stairs, poor lighting, or call lights that are out of reach or not properly answered. Personal conditions that raise the risk for falls include medications, loss of vision, gait or balance problems, weakness, paralysis, and disorientation. A resident who is disorientated means that they are confused about person, place, or time. Reporting falls. Whenever a resident falls, it must be reported to the nurse. Always complete an incident report, even if the resident says he or she are fine. When a resident falls, leave the resident where they are. Stay with them. Stay calm. Assure them that help is on the way. Never move a resident that has fallen. They could be injury. Call the nurse so that she may assess the resident for any injuries. Use smooth, steady movements and avoid jerky movements when repositioning or turning or lifting a resident. Back pain or trauma may result from repetitive small injuries, not just from a single event. Keep one's own muscles strong through fitness and exercise. This is really important. Now we're going to talk about some general principles for lifting and moving a resident safely. We need to understand how the resident may be moved, what he or she can do for themselves to help. Always check the care plan or ask the nurse if you have any questions about their mobility. You're going to hear terms in the health professions such as weight bearing, limited assist, and extensive assist. These will be used numerous times. Always plan for help from other staff members when one is moving or lifting a resident. Use mechanical devices or other devices whenever possible. Some facilities have implemented a no lift or free lift or safe lift policies. I have found this to be very true. Just about every facility that I have been in are no lift or free lift or safe lift facilities. What this means is we cannot physically lift residents that are totally dependent on us to be moved. We must use the mechanical lifts. You need to know how to use these devices safely. We need to approach the resident with confidence. Remember, they need to be able to trust us. They need to know that we know how to work the equipment that we are using. Can you imagine being put into a lift and swinging in the air and thinking that your nurse's aide is unsure of how to use the device? That would be really, really scary. We should work in coordination with lifting or moving a resident with another person. If you have a resident that is going to take 2 people to assist them in moving in bed, we really need to talk to our other team members, see when a good time is to be able to give the care to the residents that we need to provide safety. Always explain the procedure to the resident. Tell them what you're doing as you're doing it. This makes them feel more comfortable. Give cues to the resident about what they can do to help. For instance, Ms. Smith, when I roll you over, reach over and grab that handrail and try to push yourself some. Again, that's promoting independence, and we need to be doing that at all times. Give support to the heaviest part of the body. This is usually the trunk of the body. Position residents so that gravity can help with them when they move. A good example of that would be, say you need to have a resident move up in the bed because they've scooted down. So a good way to do that is to put the head of the bed down and the feet up. Then, if possible, have the resident take their arms and grab the headboard, and then have them pull themselves to the head of the bed. Take time and allow your residents to maintain control. A resident may experience a period of dizziness when changing positions. This is called orthostatic hypotension. This is when a person, when they change positions, their blood pressure cannot stay level. So when they go from a lying to a sitting or a sitting to a standing, always give them a few minutes before you move to the next position. Always ask them, are you dizzy or lightheaded? If so, give them a few minutes. If it continues, then either sit them back down or lie them back down and notify the nurse immediately. Observe and report the resident's ability to participate in the activity and how they respond to the activity. Now we're going to discuss some safe practices with a transfer belt. Sometimes this is also called a gait belt, and this is used for ambulation. The belt is placed around the resident's waist. The nursing assistant stands behind the resident with one hand holding onto the belt. This should be with your hand underneath the belt, not over the belt. The belt allows the resident better control over their center of gravity. Some belts have multiple handles to grip while assisting the resident to transfer or walk. Always use a protective layer of fabric between the resident's skin and the belt. This is usually their clothes. This helps to keep skin breakdown. Check belt for tightness. The belt should be tight enough to stay in place, but loose enough to be comfortable. Always make sure that the resident's breasts are not pinched in the belt. Elderly women are not always going to wear their bras. And we also know that as we age, gravity hits us and everything seems to fall down, including their breast. So we need to remember to not allow them to be pinched in the belt. Residents should wear non-skid shoes. This is extremely important. Anytime you move a resident, please always make sure to put their shoes on. Never transfer or ambulate a resident in their bare stockings or their bare feet. Residents should place their hands on the CNA's forearms or the elbows while being assisted, not on the CNA's shoulder or neck, because they will pull you down towards them and could cause injury for the CNA. Observe and report the resident's ability to participate in the activity. Always report the resident's response to the activity. Anytime our residents have a change in their ambulation, it should always be reported. Remember, we need to keep our residents safe. Always use good common sense. When we do our skills, we're going to review and demonstrate some of the principles that are practiced or covered in the prior slides. These are general practices for lifting and moving a resident. Also, safe practice when we use a gait belt or a transfer belt. As you can see on this slide, these will be some of the things that we are going to practice when you come to skills. We are going to assist each other to raise to a sitting position in bed from a lying position. And then we will go from a sitting position to a standing position. Remember, you're going to need to ask the person, are you lightheaded? Are you dizzy? Is your vision blurred? Then you need to remember what to do if that is the case. We're also going to practice moving the resident towards the head of the bed. Notice the abbreviation on this, HOB. That is the abbreviation for head of bed. You're going to see this a lot in your job. We're also going to practice moving the resident to the side of the bed. We're going to use a lift sheet, or sometimes this is called a draw sheet. This is a great tool to use when you have a partner in repositioning your resident in bed. We're always going to help, and we're going to practice assisting a resident to move independently in a bed, because we know how much and how important independence is to our residents. Remember, it gives them self-worth. When residents lose their independence, they feel like they've lost control of their life. So that's why it's so important that we promote independence. We will also use log rolling or repositioning in bed. We will practice that. Some other things that we're going to practice is transferring a resident from either a chair or a wheelchair from their bed or to their bed and back to their bed, including proper placement of the wheelchair or the chair. We're also going to transfer from a bed to a stretcher. And we're also going to practice using the slide board. This is a great tool to use, especially with residents that are paralyzed from the waist down. So these are just some of the basic principles that you will be demonstrating and learning when you come to the skills fair. Now let's talk about the effects of common postural changing with aging. The first thing we need to talk about is body alignment. Maintaining proper body alignment is the fundamental principle of all positioning. Alignment means to be put in a straight line. We look better, feel better, and our bodies function more efficiently when they're in a good alignment. Alignment is the correct position of the resident's body. This means that they're in a straight line. Their head's up, their neck and back is straight, their chest is out. When they are sitting, they should be in a 90-degree angle. Their fingers should be slightly flexed and their feet in a walking position. Correct positioning helps to prevent contractures, which means shortening or tightening of the muscles. It also helps with pressure on the tissues. There will be times when you have a resident that's very dependent on you for repositioning. Most residents cannot tolerate sitting in a wheelchair for a long period of time. These residents should be repositioned every 1 to 2 hours while in a wheelchair, and they should never be up in a wheelchair for more than 3 hours without being returned to a bed for a resting period. Now let's describe common postural changes that happen with aging. Osteoporosis and other conditions may contribute to changes in our resident's posture. Their head and neck flex slightly forward, causing the resident to look down. I have a little saying that I always like to say, what looks down goes down. Their spinal cord shortens and becomes more rigid and flexes forward. This causes their shoulders to flex forward or is even more just towards the ground. Hips and knees are slightly flexed to compensate for the other changes that are going on in their spinal column. Postural changes may cause the individual to have poor balance, and this can lead to falls. Let's talk about falls for a little while. Most accidents that occur in a facility are falls. Falls can be caused by an unsafe environment. It also can be caused by the resident's loss of ability in their mobility. Diseases and medications, this is another problem too. Problems resulting from falls range from minor bruises to fractures and even life-threatening injuries. A fracture is a broken bone. Falls are particularly common among the elderly. Older people are often more seriously injured by falls, as their bones are more fragile. Be especially alert to the risk of falls. Here are some factors that raise the risk for falls. The room being cluttered, throw rugs, exposed electrical cords, slippery or wet floors, uneven floors or stairs, poor lighting, or call lights that are not in reach of the resident are not promptly answered. Personal conditions that raise the risk of falling include medications, loss of vision, gait or balance problems, weakness, paralysis, and also being disorientated. Disorientation means confusion about person, place, or time. So now I just want to talk a little bit about some guidelines that we can do to prevent falls. Keep all walkways free of clutter, trash, throw rugs, and cords. Use rugs with a non-slip backing. General rule of thumb, we don't use rugs in a long-term care facility. However, you might see this if you happen to work in home health. Have residents wear non-slip, sturdy shoes. Make sure their shoelaces are tied. Residents should avoid wearing clothing that is too long or drag on the floor. Keep frequent used items close to the resident including the call light and their water pitcher. And for males, that even includes their urinal. Always answer call lights right away. This is their only way to get you to know that they need assistance. Make sure that you always keep the call light within reach. Immediately clean up spills on the floor. Report loose handrails. If used, check placement of body or bed alarms and see if they are working. We'll talk a little bit more about this in another unit. Mark uneven floors or stairs with colored tape to indicate that there's a hazard. Improve the lighting where it's needed. Lock wheelchairs before helping resident into and out of them. Lock bed wheels before helping a resident into and out of bed or when giving care. Return beds to their lowest position when you are finished with care. This is really important. Get help when moving residents. Do not assume you can do it alone. Offer trips to the bathroom often. Respond to requests for help immediately. Think about how you will feel if you had to wait for help to go to the bathroom. Leave furniture in the same place. Know residents who are at risk for falls. Pay close attention so that you will give them the help often when they are needing it. If a resident starts to fall, be in a good position to help support her or him. Never try to catch a resident when they're falling. Use your body to slide him or her to the floor. If you try to reverse a fall, you may hurt yourself or the resident. When we have our skills day, we will demonstrate and learn correct body alignment using the following positions: supine and semi-supine position, the prone and semi-prone position, the Sims, the left semi-prone position, and the Fowlers, the semi-sitting position. Also, chair or wheelchair position. You will need to be able to demonstrate the correct body alignment for each one of these positions. So now let's talk about some of these positions. A person in a supine position is laying flat on his or her back with their face up. The prone or lying on the stomach position is when a person is in the prone position is lying on his or her stomach. The Fowler's or semi-sitting position is a person lying in a Fowler's position is particularly reclined. Their head is up with their knees bent slightly. The Sims are lying on their left side with one leg drawn up. A person lying in the Sims position is lying on his or her left side with one leg drawn up and supported by a pillow. These positions help with correct body alignment. We also use some of these positions when we are doing certain procedures to a resident. Now I would like to talk about using devices that aid the resident in maintaining a correct body alignment. At times there will be residents who spend a lot of time in bed and often need help getting into a comfortable position. They also need to be changed in their position periodically to avoid muscle stiffness and skin breakdown or pressure sores. Too much pressure on one area for too long can cause a decrease in circulation. This can lead to pressure sores. Positioning means helping the resident into positions that will help them to be comfortable and give good health for them. Bedbound residents should be repositioned at least every 2 hours. We must follow the care plan. Document the time and the position with each change. Always check the skin for signs of irritation whenever you reposition a resident. Some of the devices that we will be using are going to be pillows. We can place pillows in different areas to avoid having pressure on some of their parts of their body for a long period of time. We also use foam wedges and other shapes of foam to help to relieve pressure. As you notice in the slide, there are also some other ones that are included. An adduction splint is to help with a resident who has recent hip surgery. The palmar hand-wrist splint is to help the resident to keep their hands in an open position. We can use a hand roll for residents with their hands that are starting to close. The best way to do this is just to take a wash rag and to fold it up and to place it into their hands. A footboard is also used to help the resident to keep their feet in an upright position. These are just some of the devices that aid the resident in maintaining a correct body alignment. We will practice these when you come to skills. There will be devices that assist the resident in walking or ambulating. We need to understand these general guidelines when using a walker, a cane, or crutches. Some of these general guidelines are: check for the resident's ambulation goals or restorative activities. Again, we will talk about the care plan later on in this unit. Check the device before using it to make sure that it is safe. For an example, all of the above devices should have slip-proof tips that are not cracked or torn. Residents should wear slip-proof shoes. Remember, never get a resident up or ambulate a resident without shoes. Use a transfer or gait belt when assisting the resident with the above devices. Stand slightly behind and close to the resident's side, holding onto the center back of the belt. Factors that will influence where the CNA stands includes the resident's ability to stay upright, the strength of each leg, and also the resident's field of vision. Always encourage the resident to walk to activities, even if it would be faster to take the resident in a wheelchair. This, again, promotes independence and gives self-worth to our residents. Encouraging the resident to walk with good posture, their head up and looking forward. The CNA may place a hand in front of the resident's shoulder. This is called guarding, and it encourages good posture. Always observe and report the resident's activity and any sign of illness or weakness or unable to do any of the following that we have just talked about. Now, let's talk about the walkers, the cane, and the crutches. When using a walker, the resident picks up or rolls the walker. He places it about 12 inches in front of him. All 4 feet or wheels of the walker should be on the ground before the resident steps forward to the walker. The walker should not be moved again until the resident has moved both feet forward and is steady. The resident should never put his feet ahead of the walker. We should always promote stability and prevent falls. The cane, in using a cane, the resident places the cane about 12 inches in front of his strong leg. He brings the weaker leg even with a cane. He then brings the stronger leg forward slightly ahead of the cane and then repeats the steps over again. When using crutches, first and most of all, the resident should be fitted for the crutches and taught to use them correctly by a physical therapist or the nurse. The resident may use the crutches several different ways. It depends on what his or her weakness is. No matter how they are used, weight should be on the resident's hands and arms. Weight should not be on the underarm area, which would be the armpits. Walk slightly behind and to one side of the resident. Stay on the weaker side if the resident has one. Hold the gait belt if one is being used, and one should be used. Always provide security. Watch for obstacles in the resident's path with all three of these devices. Ask the resident to look ahead, not down at his feet. This promotes resident safety and prevents injuries. Encourage the resident to rest if he or she is tired. When a resident is tired, it increases the chance of a fall. Let residents set the pace. Discuss how far he plans to go on the care plan. And remember always to prevent falls. After ambulating with one of these devices, remove the gait belt. Help the resident to a position of comfort and safety. Always remember to report any problems that the resident may have when using a walker, a gait, a walker, a cane, and crutches. Never change the height of the walker or the crutches. Physical therapy sets the height for these on an individual basis for the resident. Now we're going to talk about the use of using a wheelchair as a mobility device. When you come to skills, you will be able to learn and then you will demonstrate the use of a wheelchair. Always inspect the wheelchair prior to use to make sure that it is safe. Understand mobility or locomotion goals for the resident. We need to encourage residents to participate as much as possible. Again, this promotes independence. Alignment devices may be used to help maintain proper positioning. The resident's feet are placed securely on the footrest. Know where the resident's feet are positioned while the wheelchair is moving. This is really important to prevent injuries. Residents' arms and elbows are positioned inside the armrest. A lap blanket is provided for warmth and protection of modesty. Tuck ends firmly around the resident, preventing them from being tangled in the wheels. When moving a wheelchair, usually move the wheelchair forward by pushing from behind. Back a wheelchair into the elevator when entering. The resident should face the elevator doors. When traveling down a steep ramp, move wheelchairs backwards. This will allow the operator to maintain control of the wheelchair. Move carefully when going through swinging doors or around corners. This will prevent injury. Set brakes when residents move into and out of the chair. Always encourage the resident to set brakes for themselves. Again, this promotes independence. Set brakes when chair is parked, for example, at the dining room table. We also need to watch for pressure relief. Show residents how to change position to relieve prolonged pressure on the buttocks, hips, and coccyx. Wheelchair push-ups change pressure from one hip to another by leaning to the side. Cushions that distribute pressure may be used on the chair seat. Most wheelchairs will have a pressure relief pad in their wheelchair. This will be in the care plan and must be used at all times to relieve pressure on the resident's bottom. Now we're going to talk about the use of mechanical devices. Facilities may have mechanical or hydraulic lifts available to transfer residents. This equipment avoids wear and tear on your body. Lifts help prevent injury to you and the resident. Some key points about using a mechanical lift is to make sure that you are trained to use each device that the facility has for using to transfer a resident with a mechanical device. Never use equipment you have not been trained to use. You or your resident could get hurt if you use the lifting equipment improperly. There are many different types of mechanical lifts. You must be trained on the special lifts that you will be using. Most facilities require 2 staff members to assist when using a mechanical lift. You need to check their policies and procedures on using mechanical lifts. Most, or I should say, all facilities do require 2 people to use a mechanical lift. In some facilities, if you are caught using a mechanical lift on your own, it could mean that you will be terminated immediately. We need to always remember safety and common sense. Persons who cannot help themselves are transferred with mechanical lifts. So are persons that are too heavy for the staff to transfer. The devices are used to transfer to and from bed, chair, stretches, tubs, shower chairs, toilets, commodes, wheel pulls, and even vehicles. There are manual, battery-operated, and electrical lifts. Some lifts are even mounted on the ceiling in some facilities. When using mechanical lifts, you will also be using a sling. The type of sling used depends upon the person's size, condition, and other needs. Slings are padded, unpadded, or made of a mesh material. Standard full slings are used for normal transfer. Extended length slings are used for persons with extra large thighs. Bathing slings are used to transfer the person directly from the bed or chair into a bathtub. The sling is left in place and attached to the lift during the bath. Follow the agency or the facility's policy and the manufacturing instructions for using any of the slings. Before using a mechanical lift, again, you must be trained on how to use it. It must be in good working condition. The slings, the straps, the hooks, and the chains must be in good working condition. The person's weight must not exceed the lift's capacity. At least 2 members are always needed in using a lift. Now we're going to talk about the purpose for using a mechanical lift. Again, it's to move residents to a standing position. This is called a sit-to-stand lift. You need to check the care plan to see what lift is to be used on the resident. Physical therapy assesses all residents to know what their needs are, and then they're going to give us what lift that we are to use. It is very important that we use the lift that is in the care plan. We must never, ever do anything that is not in the care plan. Using a sit-to-stand lift. There are some guidelines that you need to know about. First and most, the resident has to be able to bear weight on their legs. We have to know that the sit-to-stand lift is an assisted device to help them to a standing position. They must also be able to hold on to the lift with both arms or hands. Now, there are times that some residents can only put maybe 3 fingers on to be able to hold. That is okay, as long as it is in the care plan for them to use the sit-to-stand lift. Now we're going to talk about moving a resident to a chair or a wheelchair with a total body lift. This is a device that is going to lift the whole person up into the air and then move them from one position to another. Again, you must check the care plan to see what lift is to be used on the resident. The purpose for using mechanical lifts is to move a resident to other activities such as ambulating and moving them into whirlpool tubs or even to weigh them. The purpose of using the mechanical lifts is to protect both the CNA and the resident. Now let's talk about promoting safety and comfort when using a mechanical lift. Mechanical lifts vary among manufacturers. Also, manufacturers have different models. Knowing how to use one lift does not mean that you know how to use all of them. Always know the manufacturer's instructions. If you have any questions, ask the nurse or the physical therapy department. If you have not used a certain lift before, ask for training before you use it. Mechanical lifts must be in good working order. Tell the nurse when a lift needs repaired or is not working properly. Some mechanical lifts are powered by batteries. The batteries must be well charged. You are responsible for making sure that the batteries are switched when needed and put back on the charger. The person that will be lifting up and off the bed or chair should be comfortable in the slings that we are using. Falling from the lift is a common fear that residents have when we use these mechanical lifts. To promote the person's mental comfort, always explain the procedure before you begin. Also, show the person how the lift works. Some other things that you need to take in consideration when using the lifts. You need to make sure, as far as comfort level, make sure that wherever the lift is putting pressure on the resident's skin, that you pad it, especially when using the full body lift. I have come across times when a resident that has been using a full body lift has had skin tears or bruises underneath or close to the back of their legs, right above their knees. This seems to be a problem at times. A good thing that you can do is to take towels or even a bathing blanket and fold it in half and put it underneath the resident's knees. Remember, we always have to be monitoring our resident for any change in their skin condition. We should always report any problems that have arise with when using any of the mechanical lifts. Always remember safety. Always remember comfort. Always remember that the resident that's being placed in these lifts could be worried about falling. Reassure them. One person should always operate the lift. The other person should be in charge of keeping the resident calm and making them feel secure. In doing that, you will help with the residents' well-being. We will practice using the stand-up lift and the full body lift when you come into the skills fair. When we are at the skills fair, we will take turns being the resident and being placed in the stand-up lift and the total body lift. This will give you an idea of how the resident feels when they are put into the mechanical lifts. I hope you learned a lot from this unit. There'll be a lot more things that we will cover when you come into skills, and I am looking forward to meeting all of you. Just a few more things for you to remember is independence, independence, independence. Remember, it really helps the resident when they are able to do as much as possible. It also gives them self-worth, and it also makes them feel like they have more control of their life when they are able to do things on their own. Always remember, if we don't use it, we lose it. So encourage your residents as much as possible. At times you might need to use different techniques to do this, and some of those techniques will be taught in later units. The more you get to know about your resident and how they live their life and their habits and their preferences, also learning about things that happened in their life, maybe even learning more about the things that they did, maybe their career, maybe awards that they have gotten, that will help you to keep the resident distracted when you're doing different skills with them. So get to know your residents. Find out what they were doing during their life, how many kids they had, what was their career. These things are going to be important tools to use when we are trying to distract our residents to help keep their mind off some of the things that we are doing. This also develops trust and a working professional relationship. Also remember that mobility is not just for our residents, it's for ourselves. We must keep ourselves healthy and keep our bodies in well condition. Remember to report any problems to the nurse. I will look forward to seeing all of you on Skills Day. Now, there are some more key points for using the mechanical lift. And we've kind of talked about these, but I'd like to review them just one more time. The key points of using a mechanical lift: follow the facility's policy regarding the number of staff members required for the safe lift. Many times, safe operation will require 2 or more trained staff. Remember, I've already kind of stated, just about every facility requires 2 people to use a lift. Understand how to use that lift. Follow the operating instructions. Practice with it before attempting to move a resident. Check for operational safety before attempting to move a resident. Consider the resident's response from being lifted. Provide for safety. Lessen the resident's anxiety by showing competence and confidence in using the lift, and by showing the resident how to participate in the lift. Use brakes appropriately. Position the lift sling and/or straps in the correct manner for the type of lift. Congratulations, you have now completed Unit 6. We will look forward to again seeing you on Skills Day. I hope this helped. We'll talk more about some other things when we have our day together on skills. Thank you.